Hi and welcome to my podcast, the Fertility, Motherhood and Wellness Show, True Stories with Dr. Rajeev. Through this podcast, I will be dealing with issues related to fertility, safe motherhood practices, as well as women's health. Infertility is on the rise in India. Current statistics have shown that 27.5 million couples actively seeking children suffer from infertility, and this affects both men and women equally. In terms of percentage, at least 10 to 15% of married couples are experiencing fertility issues at some point. 1 in every 2 millennials are delaying having a family and think that they can conceive later. 54% of those delaying pregnancy right now face issues in conception in their 30s. I had a couple who came to me after about 4 years of a love marriage, unable to conceive. While going through investigations, we realized that both of them had thalassemia minor. They had a child ultimately through IVF, and the child escaped with thalassemia minor, but it could have been catastrophic for the child if a natural conception had indeed happened. Another couple who decided to postpone having babies till 4 years after marriage came in one day only to realize that the husband had no sperms, and they wished that they had found out earlier and hadn't wasted that much time. Yet another lady conceived normally without any treatment, but then realized she had grossly abnormal thyroid gland function and diabetes as well. It is not that for any of these couples the ending was bad. They did live happily ever after. But the same situation could have been dealt with much better without wasting time and without the anxiety that they had to suffer, if only they had the vision to seek preconception counseling. So, what is this preconception counseling? So, preconception counseling, I would say, is basically an advisory session provided to a couple before they start to try and have children. Preconception health also means taking care of your own health to ensure that if you choose to start a family, you will be healthy enough to do so. Whether you're thinking about now, the near future, or not at all, the key is about setting goals, making a plan, and more importantly, taking care of yourself during the preconception period, since the health before pregnancy can affect the health of your child. Who are these couples who should be availing of preconception counseling? Are you one of them? Fertility counseling is recommended for all couples who are yet to start a family. They may fall under the following categories. 1. Couples who are planning to get married. 2. Newly married couples. 3. Couples married for some time and are ready to start a family. And 4. Also, couples who are married and are thinking of delaying for a few years before starting a family. So all these 4 heads or people falling under these 4 categories should be availing of preconception counseling. Going in for a fertility counseling will help couples understand these following 10 things. 1. There are 4 basic requirements for fertility: good eggs, good sperms, open fallopian tubes, and a normal hormone levels. Are these criteria satisfied? 2. If there is any existing medical condition which needs evaluation and correction before having babies, so then if there are certain conditions, they need to be evaluated and corrected. 3. Are there any lifestyle changes that are required? 4. What is the fertility score and the reproductive window? 5. What are the peak fertility years if one wants a natural conception? 6. Whether one can delay starting the family or not, and for how long can they safely delay. This is where preconception counseling is helpful to this group of couples who are not immediately thinking of having babies. 7. By what age should the couple have their first and the second child respectively? 8. What steps they must take to maintain optimum reproductive health and avoid future conception issues. 9. How to prepare for a healthy and smooth pregnancy naturally. And last but not the least, fertility preservation options in case the couple is planning to delay motherhood for a long time. So how does preconception counseling happen? We normally start with a basic question. Do you wish to have babies right now? If the answer is yes, then do you wish to go down that route immediately or in the next 3 months or 6 months? Why is that important? Because my plan for your evaluation and vitamin supplementation and other aspects will be designed accordingly. If you do not wish to go down that route, then we discuss and document the various reasons why you wish to delay, and we then proceed to evaluate basic fertility for both partners. In the second meeting, once the reports are ready, we discuss the pros and cons of delaying and what options are available to safeguard future fertility. Next, I take a detailed history to understand if there is anything in your family history or the personal history which could cause problems with future fertility or the health of the mother or the baby. Thus, I ask several detailed questions such as your family's genetic history or any history of thyroid disease, epilepsy, diabetes, asthma, blood pressure, depression, heart or kidney disease, and finally, if any previous surgeries or any other relevant treatment has been done. The 5 pillars around which I designed the preconception counseling sessions are change, investigate, correct, add, and counsel. Let's take them one by one. What are the things we need to change to improve natural conception? 1. Broadly speaking, lifestyle changes like sleeping well and avoiding late nights, etc., while some of the focus areas include weight management, diet, exercise, smoking, alcohol, stress, and in case of men, avoiding steam, sauna, and hot baths. We spoke about 5 pillars, right? And change, the first one of them. So the next pillar is investigation. The first thing we need to investigate is the fertility quotient of the couple, the AMH done via a blood test, an antral follicle count done via a vaginal ultrasound on the 2nd or 3rd day of periods for the woman, and sperm analysis for the man needs to be done. 2. Hormonal analysis needs to be done. For example, the thyroid and the prolactin levels. Some others may be needed depending on the individual case. 3. Follicular monitoring or serial ultrasounds are done to ascertain how the follicle or the fluid-filled balloon containing the egg is growing inside the ovary. And finally, when in the cycle does the egg get released? This is the most fertile period for the woman. 4. Genetic disorders like thalassemia. And 5. Medical disorders like diabetes and anemia need to be tested for both partners. 6. Immunity status against viral infections like rubella and varicella or chickenpox, and some others which I will mention shortly, need to be ascertained. And finally, point number 7, smears from the mouth of the womb for chlamydia infection needs to be taken, as such infections, if present, can cause fallopian tube damage. Then comes the aspect of correction. During this phase, my team and I work towards the correction of all that is abnormal but correctable. We bring together a team of specialists such as chest specialist for asthma, endocrinologist for diabetes, neurologist for epilepsy, psychologist or psychiatrist for depression, or nutritionist for weight loss, and so on. The 4th pillar is addition, and here I look at all those additions that will make future fertility and pregnancy safe. Additions are of 2 types. One of preconception vitamins like folic acid, vitamin D and B12, especially for vegetarians. This should be ideally started 3 months before conception. Secondly, additions are in the form of vaccinations. These include vaccinations against diphtheria, whooping cough, tetanus, measles, mumps, rubella, chickenpox and hepatitis B. Of course, Many or most of these vaccines would have been given to you as a child, but in case the immunity wasn't built, or if the vaccine was missed, this preconception period is a good time to boost up your immunity against these. Another vaccine which is vital and should be taken by all is the influenza vaccine. This is to be taken yearly and protects against the 3 commonest virus strains causing flu as well as the swine flu. Last but not the least is the pillar of counseling. This is where we collate all the information that we have gathered over the last few days or weeks, and we work towards answering each and every question or doubt that you have, and also making suggestions from our end based on what we have discovered. This encompasses 1. General counseling and reinforcing the importance of corrected BMI or body mass index, quitting smoking, reducing alcohol intake, taking a balanced diet, getting a dental health checkup done, reducing stress, exercising, etc. Next, we talk about the most fertile period for the couple based on our tests. Next, we discuss the timing and frequency of intercourse, as there are innumerable myths pertaining to this. Basically, to put in a nutshell, sperm survive longer than eggs. Thus, even if intercourse happens days before ovulation, it still works. But eggs don't survive more than 12 to 24 hours. Intercourse thus needs to be done on alternate days and should happen before ovulation or maximum on the day of ovulation. If it happens a day or two after ovulation, it may not be successful. Again, intercourse need not start before the 11th or 12th day of periods if it is for fertility reasons, because ovulation is unlikely before that. Remember that repeated ejaculation will reduce the quality and number of sperms even in the most fertile of men. Now, based on the reports of ovarian reserve testing and sperm counts, we then discuss the possibilities of natural conception and timelines for going ahead and trying naturally. Another important aspect to discuss is the importance of age, both in terms of fertility as well as Down syndrome. Now, Down syndrome is the most common cause of mental retardation in children. It happens because of a defect in chromosome 21 in the fetus, while the baby is still inside the mother's womb. It is more common if the mother is above the age of 35, although it can happen if she is younger too. If the couple has any genetic reports which are abnormal, for example thalassemia, then we use this opportunity to discuss how we can give them a healthy baby without any complications. Lastly, I also discuss social egg freezing, sperm freezing, and contraception with those that wish to delay conception for a few years. What I have shared today is just a small gist of all that is done, because it would be impossible to discuss everything through this podcast. The history and treatment sheet that we use in our clinic to do the preconception counseling runs into almost 11 to 12 pages. So as you understand, it's quite exhaustive. I may not be able to cover everything, but I hope I have been able to impress upon you the need for preconception counseling at least. Even if I manage to light a spark of curiosity, I guess the fire will burn sooner or later. This brings me to the end of yet another podcast episode. I hope you enjoyed listening to it as much as I enjoyed making it. If you get a chance, do look up my website www.drrajeevagarwal.co.in and the associated blog. I also have a YouTube channel in my name. Do email me on fertilitywithoutborders@gmail.com if you have any queries or if you want me to create a podcast on any topic of your choice. This podcast is available on Apple and Google Podcast as well as Spotify. Do subscribe and leave your comments and suggestions on the Apple Podcast app. That's the only way we can make this better. Looking forward to great interactions. Keep listening.